morning.
Today your patient will be Annie Sherman. She's a 64-year-old woman who was admitted last night with appendicitis from the ER. She had an appendectomy and she was a smoker for the past 10 years and she smokes a pack a day. She has a history of being overweight but has began to have a healthy lifestyle and lost 20 pounds. She tolerated the procedure well and is awake and alert. She has 4 milligrams of Dilaudid ordered for pain every 4 hours.
Good morning, Mrs. Sherman. My name is Denise, and I'll be your student nurse today. How was your night?
It was horrible. I barely slept, and my belly hurts so bad. I feel like I can't catch my breath.
Well, Mrs. Sherman, if you're having difficulty breathing, let me make the bed flat and see if that will help you.
Okay. Feels like it's getting worse. Oh, this is not easier.
Okay. A little trouble breathing, are you, Mrs. Sherman?
Yeah.
Here. We'll just get your pulse.
Okay. Just a little better.
So, Mrs. Sherman, let me just count your respirations to see how much trouble you're having getting your breath.
You're gonna count how many?
We're going to count how many in a minute. So, Mrs. Sherman, we're going to continue with your vitals. We're going to take your temperature under your arm, and then we'll take your blood pressure on your upper arm as well. So, one moment, we'll get a reading. Just get you to open up, and then we'll close it, and we'll keep it just like that. And there we are, 36.5.
Is that normal?
That's absolutely perfect. And we'll get your blood. Mrs. Sherman, we're going to continue with your vitals. We're going to take your temperature.
Okay.
There we go. So we'll just get you to open up and we'll put it under your tongue. There. Can you hold it there? Are you able to keep it under your tongue and keep your lips closed?
It's too hard to breathe like that.
There. We'll just try. We'll just keep trying. There, it seems to be difficult to get a reading. So, Mrs. Sherman, we're going to continue with your vitals.
Okay.
Since you're having difficulty breathing, we'll take your temperature via the rectal route.
Doesn't that mean
I'm afraid so.
you're gonna no, what? You're not gonna do that. No, absolutely not. No.
Mrs. Sherman, I'm just going to have a quick peek under your bandage. Have a look, see what's going on.
Okay, yeah.
There we go. There. Let's take a little look. There you go. What do you think? Do you think it might be infected? How does it feel to you?
How would I know if it's infected? I'm the patient. You're the nurse. I don't know. I guess it hurts a little bit.
Mrs. Sherman, I'm just going to have a quick peek under your bandage. Have a look, see what's going on.
Okay, yeah.
There we go. There. Let's take a little look. There you go. What do you think? Do you think it might be infected? How does it feel to you?
How would I know if it's infected? I'm the patient. You're the nurse. I don't know. I guess it hurts a little bit.
We have to. Mrs. Sherman, I'm going to have a quick look at your incision site just to see what's going on.
Okay.
There we go. So it's a little bit red and there's a little bit of clear, maybe a little yellowish drainage.
Okay. What does that mean?
It's perfectly normal for your first day post-op.
Okay.
I'll go chart the findings.
Okay, thank you.
Mrs. Sherman, I'm going to take a quick look at your incision just to see how you're doing today.
All right.
Well, it looks a little pink, and there's a little bit of slightly yellowish, mostly clear drainage.
What does that mean?
I think I better call the doctor.
Why?
Doctor, can you please come and have a look at this?
What's the issue?
It's her first day post-op, and the incision, it looks reddish with a little bit of clear to yellowish drainage.
That is perfectly normal.
Mrs. Sherman, I noticed you haven't eaten any of your supper tonight. I can see you're very upset. Do you want to tell me more about how you're feeling?
Yeah, I guess.
Miss Sherman, I noticed you haven't eaten any of your supper. What's wrong?
Nothing.
Well, everyone's usually a little bit sad after surgery, so you'll be better soon. Miss Sherman, I noticed you haven't eaten any of your food tonight. You must not like the food, hey?
It's fine, I guess.
Well, what's the problem?
I've just charted on Mrs. Sherman. Could you take a look at this?
Sure.
Patient had a bad attitude this morning, was giving dirty looks. She was, during care, was quiet at times and seemed to be in an angry and aggressive mood.
I think maybe we should reword that because you try not to use judgmental terms when charting.
Okay. Hi, I just finished charting on Mrs. Sherman. Would you take a look and see if this is okay?
Sure.
0700, patient mood okay.
Is that everything?
Mm-hmm.
Did anything else happen today?
Oh, just the usual. I've just charted on Mrs. Sherman. I wonder if you could take a look.
Sure.
So, 0700 received client for care and entered room. Client is awake, sitting up in bed with worried expression and clenched fists. When prompted, patient replied, "I don't want to talk right now, but thank you for asking." Surgical site assessed as expected per 1 day post-op. Vital signs stable. Will continue to assess.
That's great.